Doesn't do any good to get on the hair. Your hair is dead.
Your hair is dead.
Nourish my hair and everything. It's like nourishing a dead leaf, okay? It doesn't happen. Okay? It could be a
3 effective treatments for hair regrowth.
If I was a patient and I came to you and I said, I'm in my late 20s, early 30s, I'm having significant hair loss, we've checked out to make sure no other underlying major medical condition. It's just simply me, like many other women, are having this type of very common hair loss. You would probably say, there are roughly 3 things we could do. You would most likely say, let's start with Minoxidil. Right. Am I pronouncing that correctly?
That's right.
Okay.
And that's right, because that's the easiest and the cheapest.
Right.
So there are 3 main medications that my mom prescribes often to her patients. However, Minoxidil, often known as the brand name Rogaine, is commonly her favorite. It's not a prescription, it can be applied topically, and you can see results in 4 to 6 months.
We would know this, the brand name Rogaine. How do you use it?
Okay, I use 5% right from the start. You want to fluff out your hair, lie back, and you would take the dropper, 1 cc, and you would release a little bit, and you would feel it on the scalp. You don't want to, if you don't feel it, it's not on your scalp.
And so you just kind of let it roll back on your scalp.
And you go all the way back, and then you release a little bit more here at the frontal hairline.
Yeah.
And it goes all the way back, and then there. Okay, so you want it to go back to your crown, and that's how you use it.
If you're using the liquid version, do you have to drench your entire, or does the bloodstream pick it up?
Well, there's an adjacent spread out.
Taking the foam and rubbing down their part. Can you do that as well?
Yeah. Now, one of the things I have to tell you, if you do get it on your forehead, there's 2 things that can happen. One, I've noticed that if I get it on my forehead over like a couple of days, I actually get a headache. Okay?
Interesting.
Okay? Another thing that happens is that if you continually get it on your forehead, you can sometimes get little hairs there. Okay? So you have to be careful.
So here are some things to remember with Minoxidil. There can be at first a temporary increase in hair shedding, but remember it's safe, cheap, and effective.
There's other things that grow hair, but not as well, and they cost a lot of money.
Yeah, so these are the more straightforward ones.
It's straightforward and it's cheap. I literally had hundreds and hundreds of people over the last 35, 40 years on this.
The next is Sparanolactone, brand name Aldactone. Sparanolactone does require a prescription, but it can be taken orally and results can also be seen in 4 to 6 months.
So for me, for many years, for 30 years, I've used it myself for acne. And as anyone who knows me, as they went to me as a patient for acne, if you were a woman, I always want to try it because it was very safe. It really could clear up acne and keep clear.
It could clear your skin and it could help you with your hair.
And it could help you with your hair. Downside is Sparanolactone. Okay, if you take Sparanolactone, you can sometimes see breast tenderness and even a little slight enlargement of breast tissue.
Got it.
When men take it for heart disease, they sometimes will see a little bit of swelling of their breasts. So I did not use it in men. It might have worked, but a lot of men don't want to have to wear bras.
Right.
And lastly, Finasteride, brand name Propecia. It does require a prescription, it's taken orally, and results can be seen in 4 to 12 months.
Okay, so Propecia is the brand name of Finasteride.
Finasteride.
Okay.
And Finasteride you would take orally.
You take orally, okay?
And now you take that as well.
Yes.
What's interesting is why was that always seemingly at first marketed to men?
Because it was used primarily to decrease the size of the prostate gland. So it's used for males who have prostatic hypertrophy.
Finasteride, or known as Propecia, is a medication in which women cannot get pregnant on. A good thing my mom has noticed, though, is that just several pills a week for her can be incredibly effective. And with these 3 treatments, they can be used together or separate. And of course, there are other treatments out there, but these are the ones that my mom has seen in her own practice work the best. Okay, there you have it. I hope some of you were able to find this helpful. If there are other treatments that you guys know of, please share, because I know that we would love to hear about them. And if you happen to have any additional dermatological questions for my mom, let me know.